Healthcare and social services. That is the question I'm answering today. I did a poll recently about what you'd like to know more about and how it compares to other countries, and your votes have come in, and we are going to discuss how healthcare and social services here in Serbia compare to other countries. Now, on the most recent poll I did, the question was, what do you want to know more about comparing Serbia with other countries? And this one came in as a tie with a 38% vote. And then the second one that was tied in was cost of living differences. I chose to go in with healthcare social services simply because there are lots of content out there on the cost of living when it comes to Serbia. I even have one as well. But if that's something that you want me to do a video on in the near future, please leave a comment in the comment section. And if you could, please let me know what you specifically want me to look at, because when it comes to cost of living, that is a pretty broad range. Are we talking real estate? Are we talking cars? Are we talking grocery prices? What are we exactly talking about? So if you can let me know that in the comment section of this video. Also, don't forget to like and subscribe to this video. Hit that bell icon so you can get notified when more videos come out like this, and so that I can get this information out to the people who are looking for this type of information. Now, let's dive into the Serbia's healthcare system before we get into the social services. And there are two types of healthcare systems in Serbia. We have the public healthcare system, and of course we have private healthcare system. The public healthcare system is a government-funded system, which means that the citizens of Serbia pay into it because the government doesn't actually have their own money. And these services on the public side are available to both private citizens and permanent residents of Serbia. If you are coming into Serbia with a temporary residency, you are going to need healthcare insurance here. Now, that might differ, down the road if they change policies. However, you are going to be limited to which facilities that you use as a temporary resident as well. Now, we've had some questions about asking, hey, listen, I'm coming in from the EU, and we can get a certain type of insurance here in the EU that covers you for Serbia as well. And does that work? Well, that all depends on who's covering your temporary residency. In our professional opinion, it's always best just to get the insurance here in Serbia, especially since it costs only about 75 euros for a year, and be done with it and not have to worry about getting your claims or your applications denied. Now, what do the public healthcare services cover? They cover all your primary care, their specialized treatments, and emergency services. So this is a very similar system as what you would have in the United States and Canada. I would say that the public services here in Serbia are very much on par with what the public healthcare services are in Canada. Canada used to be one of the best healthcare systems out there. However, over the past 20 years, they have completely declined in quality and services. Many of the people here in Serbia that talk about the public healthcare, they say, hey, listen, you're going to have to wait for long wait times. You're going to have to wait a long time to see a specialist. The equipment isn't the greatest. And that is very much the same as what you have to deal with in Canada these days as well. And I can attest to some of the people that we've worked with from the United States saying of similar train of thought, which is happening in the United States. And so a lot of the people that we work with, a lot of citizens here in Serbia, choose to opt in for the private healthcare system. What do you get with the private healthcare system? Well, you get a higher quality of service. You get a faster service, and you get a broader range of specialized treatments as well. Their affordability when it comes to the Western Europe and the US is a lot better. You're not getting billed here tens of thousands of dollars, such as you would when you're in the United States. I've seen those bills, and I've heard from people that we've worked with, hey, listen, I had to go in for XY treatment and they sent me a $15,000 bill. And, you look at getting that same procedure done here in Serbia and you're looking maybe a couple $100, which is a lot more appealing to people. And so a lot of expats, people that are looking to move to Serbia, moving back to Serbia, and even the people that have been in Serbia for a while, they are looking at going towards the private healthcare systems simply because you get that higher rate of service. You have more modern equipment than you would, again, in public healthcare. When it comes to healthcare costs, between Serbia and Western Europe, the costs are significantly lower. So for a basic consultation in Serbia, looking between $20 to $50 for private care, where you're paying way more than that in Western Europe. And when you're looking at North America, for a simple consultation, I know in Canada on the private healthcare, you're looking at $150 just for a simple consultation with a doctor. And again, $20 to $50 here in Serbia is very reasonable. And that's one of the other reasons that many people come from other countries here and do certain procedures, because it's a lot more affordable than if they were just to stay in their own country. So they're looking at the cost of doing that procedure in their country, plus the plane ticket to come to Serbia, and finding it's still cheaper to do it here in Serbia. So that'll speak volumes. When it comes to social services, you have the public welfare system here. Now, the social services is not as robust as you would have in Canada or the United States. And I think that is a positive thing for Serbia, because it makes people not dependent on the state and not being able to take advantage of the state and sit on welfare programs for 15, 20, 30 years and have family generations go through the welfare system. So you do have pension plans here, unemployment benefits, and child support is available. That is all dependent on what you put in and what circumstances that you will fall under. You do have modest but consistent support compared to wealthier nations, and that goes back to me saying, Canada and the United States is considered a wealthier nation. However, you're not going to have the opportunity to sit on your butt your whole life and just live off the system, which I kind of, endorse that idea as well. And if you're looking to become a parent in Serbia and obtain maternity leave or parental benefits, Serbia does have a generous maternity leave or parental benefits compared to the West. Here in Serbia, you get up to 12 months of paid leave for having a child. And that is a lot better than what you get in Canada, for example. You get only about, I think from what I've heard, is up to 3 months, and then you're required to go back to work. And, how does one, after giving birth to a child, is able to go back to work and also take care of that child? And then you also have to put that kid into daycare, which is a huge expense on its own. The maternity and parental benefits are accessible to residents contributing to the social system. And so you can't just come in here and expect to obtain these benefits just simply by giving birth here in Serbia and then saying, here, give me my money. You actually have to be a tax-paying citizen here and contribute to the system. How are these comparisons with neighboring countries? So in the Balkans, you have similar public healthcare systems, but Serbia often leads in affordability and quality. That is one because Serbia is not in the EU. I know that in Croatia and Bulgaria, you have to pay higher costs when it comes to private care. Here in Serbia, you do not. And I believe that's solely because we are not part of the EU. We do not have the regulations and the fees that are associated with the EU. And that's one of the best things that you can have is being able to have a lot more accessible healthcare for not only expats, but people within the country as well. And Serbia's private healthcare is on par with countries like Hungary, so offering top tier services at a lower cost. The quality of care here, public versus private. Public hospitals are reliable but face long wait times, like I mentioned. The private sector has internationally trained doctors and English-speaking staff. So that is a huge plus, not to mention the affordability. And so for example, dental care in Serbia attracts medical tourism due to excellent services and affordability. So I mentioned earlier that people are looking to come to Serbia simply for medical procedures, and dental is one of the ones that is the top rated ones because we do have some of the best ones out there. So that is what I'd like to wrap up with when it comes to the healthcare and social services here in Serbia, how it compares to other countries. I believe that it's a great system that they have here, especially when it comes to private. Public, I saw that they're recently looking at teaming up with with Saudi Arabia to help increase the level of care that they have in their public sector here. And I hope that they do for everyone's benefit. And if you've gotten any benefit out of this video, please hit that like and subscribe button so that you can get more of these videos. Hit that bell icon so you can get notified. And I will see you on the next one.